Welcome back to HIP, so-called Health Insurance Personalized or Personalized Health Insurance, Consumer-Driven Care, Demand Control Care, so where consumers are empowered. Today's topic is, this is Consumer's Doctor on the behalf of Foremost Organization. Today's topic is cost of care. It's very important, cost of care. When you talk about cost of care, the problem here is 90% of the doctors, hospitals have no idea what are the costs of their care. 90% of the doctors and hospitals. Hospitals use charge masters as a basis for negotiating the prices with insurance companies, private insurance companies. Charge masters schedules are not related to actual procedural costs, folks. They are not related to the actual procedural costs. They are prices, not costs, essentially made up fees. Government insurance programs pay hospitals based on another artificial schedule called DRGs, Diagnostic Related Group. That's how the hospital gets reimbursed. Doctors classify diseases based on International Classification of Diseases, so-called ICD-10. ICD-10. Doctors then charge fees based on CPT codes, so-called current procedural terminology. They call CPT. American Medical Association creates this proprietary CPT fees schedule. American Medical Association. The public has no input. Competition is irrelevant. Free market forces are totally ignored. CPT codes form the basis of Medicare payment to doctors. They also form basis of negotiated amounts paid to the doctors from private insurance companies. Can you now see how the medical charges are rigged? Yes, folks, medical charges are rigged with insider terminology and self-dealing of amounts they can charge without any free market principles or consumer input, without any consumer input. Do you know, for example, doctors cannot charge less than Medicare? Yes, if you sign a contract with Medicare, you cannot charge less than Medicare. That is because government has contracts that require any doctor accepting Medicare to abide by clause referred to as most favored nation charges. That is the most favored nation charges. So under the federal law, doctors cannot accept less than Medicare fees from a private insurance. Yes, from a private insurance, folks. It is an insider's game using fancy formulas, mathematics to price fix and rip off the Americans' consumers, folks. rip off the American consumers. In most cases, third party payments from insurance companies, government, and employers distort the normal consumer price influences. They distort normal price influences, minimizing price competition and eliminate normal market pressures for transparency. What is the solution? Despite the forces working against you, you need to lower insurance premiums. How can you influence insurance premium? You may ask, how can you lower? How can you influence insurance premium? Well, insurance premiums, insurance premiums are made of medical procedure costs times the utilization, folks, times the utilization. Utilization is the number of times medical procedure is used. That's the utilization. Consumers may not be able to directly set or competitively influence the cost of the medical service. Cost of the medical, but consumers can affect the number of times a service is used. Consumers can affect that. So these are the group impacts, personal impacts on premiums, folks, through limited patient utilization services. That's where the consumers have to be. That's why consumers have to be, it has to be consumer driven. That's how we can lower the cost. Right now, consumers have been out of the loop, folks. Another aspect to this is segmenting the insured lives into like-minded classifications will lower the risk, lower the utilization groups, will benefit the lower premiums. It lowers the premiums. Once you lower the utilization, consumer groups will benefit the consumers in lowering the premiums. Keep in mind, lower medical costs through lower utilization means lower insurance premiums. Finally, this is, of course, as a result of segmenting similar health risks and comparable levels of personal responsibility, folks. Personal responsibility. Remember, high risk groups get government subsidies that lowers their premium. You need to focus on that. High risk groups already they get subsidies from the government. Lower personal utilization can lower your premiums and out-of-pocket expenses, out-of-pocket costs you pay. For example, if you have health savings accounts, you can get rewards for personal actions. For personal actions added to your HSA account. Those dollars based on personal actions and compliance can lower your premiums and offset cost sharing, offset plan of cost sharing like deductibles, co-payments, co-insurance. They can literally lower those deductibles, co-insurance, and all that stuff. Lower insurance premiums are the real reason personalized health insurance uses the risk segmentation as a basis of insurance, folks, as a basis of insurance. You have a right to purchase insurance associated with similar good or bad risk. Yes, consumers have a right to purchase insurance associated with similar or good or bad risk. Why? Because you should be able to share in savings created by pools lower utilization services, folks. Lower utilization services will result in lower premiums. Here's how pooling risk into impaired health support plans will lower insurance costs for everyone. Yes, for everyone. Personalized health insurance places the individual and small group uninsurable into impaired health plans, folks. Into impaired health plan. That means remaining insured or in a pool at better risk with lower expected costs, and also it lowers the premium by segmentation. Impaired health support coverages have government subsidies, folks. In that impaired health, 1% of the members cost 20% of the premium, whereas 15% of them have 15% of the impaired support group will have 68% of the costs. And whereas 50% can consume over 50% of the cost, folks, over 50% of the cost. So, basing on this Employee Benefit Research Institute, basing on that so-called EBRI, 1% of the group plan members generate 20% of total healthcare costs, folks. 1%. It is this population that would medically benefit the most from the impaired health support plans by having impaired health support plans. And moving this population into this impaired health support coverages will lower individual policy and small group contract costs by a similar amount, up to 15 to 20%, folks. It lowers the premiums 15 to 20% by having impaired health support coverages. Those wanting lower premiums on plans with higher deductible should have those options. Some consumers desire only short-term catastrophic coverage. Only short-term. Everyone should be allowed the choice of lower premium plan they want, lower premium plan they seek. So, finally, the cost of the care can be lowered with segmentation by health status or health risk, like well category, at risk category, chronic illness category, and catastrophic. They need to segment. So their premiums have to be based on where they are categorized. These are the group impacts and personal impacts, folks. It affects the costs. Group and personal changes in behaviors can lower the use of medical services, folks, and it will ultimately lower the cost of care, resulting reduced premiums and offsets out-of-pocket costs. Out-of-pocket costs, folks. This is the ultimate result of having segmentation in the categories and creating a impaired health groups. The rest of the folks will have lower premiums, and personal responsibility plays a big time in lowering the cost of the care by providing incentives and rewards. Incentives and rewards. Personal responsibility is very important, folks. Ultimately, consumers are the only category they can lower the cost of the care. It needs to be from bottom up, not from top down. So consumers will ultimately lower the cost of the premium and lower the cost of the care. Thank you for listening. This is Consumers Doctor on the behalf of Foremost Organization. We will see you in the next episode of Personalized Health Insurance, so called consumer driven healthcare. Thanks again.